Kiitos, Ari. Now switching to English. Very happy to be here. I will provide the review of the past fiscal year. Before going there, as our chair also said earlier, it has been a very strong fiscal year for Nightingale. So huge thanks to the Nightingale team and the board of directors. I think we are in an excellent position to continue the Nightingale growth story. But now to the review. I will talk first about the Nightingale's mission and the product, and I will focus into the value creation that we are bringing to the healthcare all around the world. Then I will go to the business targets of the past fiscal year and talk about some of the key achievements in our global operations. Then I will move to the business targets of the ongoing fiscal year, and then in the last part of the presentation we have the remuneration report. So the mission of Nightingale Health is to build sustainable healthcare and reduce health inequalities. I wanted to go a bit deeper into this and share what this actually means. So let's start from a simple question. So why do we need a more sustainable healthcare system? Well, in the current healthcare system, the system is not equal, and the healthcare system is overburdened with too many sick people, with chronic diseases that we could prevent. And this is when we look at the healthcare, the big picture of the healthcare system. It really comes down to the chronic diseases. So what we are talking about here, we are talking about the biggest healthcare problem in the world. When we see this in numbers, it's up to 90% of healthcare costs come from the chronic diseases. And then they respond to prevention very well. 4 out of 5 could have been prevented. And then looking this in numbers, so if we have 90% of the healthcare cost coming from the chronic diseases, and the cost of healthcare is, for example, here in Finland, 10% of the gross domestic product, it's 20% of gross domestic product in the United States. So 90% out of that, it's a huge amount of money. It's the scale is it's massive. So it's pretty clear that we need to change this. We have a system to change this. We call it a primary care system. So we have a part of the system that is supposed to take care of the prevention. But the problem is that the tools that are now available in the system today, they are not good enough to do preventative healthcare in large scale. So what can we do? The answer actually is very simple. Many times we are in many forums discussing healthcare, and the healthcare problems are many times we make them very complicated, and it is complicated. The challenge of healthcare is that it has a place in many different layers. It's a political question, it's a individual question, it's it's a question of medicine, it's a question of technology, it's a question of like building hospitals, healthcare centers. So there are like massive amount of different layers. And many times this complexity, it's not actually helping to solve the problem, because the problem many times seems too too big to overcome. But there is also a more simple answer in this, especially when we look at the chronic diseases and what could we do to address that problem. We simply need better tools to do prevention, because we have the primary care system to take care of the prevention, but we are lacking are the tools. So if we look this in a bit more detail, as I said, the current primary care system, it's doing prevention all the time. But what it means that the tools are not strong enough, it means that the current tools are very resource intensive and they do not scale well. When we bring the better tools, we can actually, it's a kind of a process, preventative healthcare process, that we can accelerate the actions in the system. So we just do the same things we are doing, but we do more of them. We do it in a more scalable way. We do it in a more affordable way. So we kind of supercharge the preventative, the primary healthcare system to do prevention. And when we do this, when we start preventing the diseases, we can have a smaller number of sick people. We can have less costs. We can create more sustainability and equality. It may seem that these are like very difficult targets to reach, but it's actually doable. It's actually possible to reach towards these very ambitious targets. And this is what we do at Nightingale Health. So we have created a tool that enable large-scale prevention in healthcare. So let's talk about a bit what does it mean. To understand how this new tool provided by Nightingale Health, what this tool is actually enabling the healthcare system to do. And now it's important all the time to remember that we are talking about the largest healthcare problem in the world. It's a solvable problem. So let's see what we can do with this with our technology. So in prevention, everything starts from understanding the risk of people. So preventative healthcare is not mainly targeted to the people who are already sick. Preventative healthcare is targeted to people who are healthy. And now out from the population, which is a very good thing, by far the part of the healthy individuals is by far bigger than the part of the sick people. Now what we are trying to do, we are trying to prevent the healthy people who are now healthy to become sick. We can do this by understanding the risk of developing a disease in the future. And for this, our healthcare system in primary care is doing all the time risk assessment. So the current risk assessment tools, they have a good performance. I mean, if you walk in to see your healthcare provider, your GP, they can assess your risk for cardiovascular disease risk. It works. How it's done? Many data points are being collected. So when you go there, when you go to your healthcare provider, they take lab tests, they ask questions about your family history, etc. They do clinical examinations like your body mass index, your blood pressure, and then some others, depending on the disease. And then when you go to your healthcare provider, they assess one disease risk at a time. So if you go and you ask your cardiovascular disease risk, they assess your cardiovascular disease risk, not your diabetes risk. However, if thinking the medicine, it would be very beneficial to assess both of these diseases at the same time, because there is some connection usually between most of the chronic diseases. So in summary, the current risk assessment tools, they require a lot of resources because you have to collect a lot of input data. That means that it takes time from the healthcare professionals. And because of that, we have very limited scalability. I mean, the healthcare professionals currently, they need to spend a lot of time to take care of the sick people. So there is less time to do the risk assessments. And if we don't do it, then we have more and more sick people all the time. So, I mean, the logic is pretty obvious. So how Nightingale then changes this is that our health check, we have equal or superior performance in the risk detection capability. We need very little inputs to do the risk assessment. So we need only a single blood sample, age, and sex. So we don't need these data points that the current system needs. Instead of assessing only one disease risk, we detect multiple disease risks from every test we run, from the single blood sample. So now the important point here is that with this technology, we solve the resource intensivity problem that we have in the current risk assessment tools. Because now you can basically, because you only need blood, age, and sex, you can run this, you can have an efficient way of assessing the risks with minimal resources from the healthcare professionals. I mean, you can detect the risks from an entire nation. This is how you do preventative care. This is how you enable preventative healthcare. So it's pretty big thing being able to do this. And then the time that is now being used in the current healthcare system to do this resource-intensive risk assessment, that time can be used to do something else. Let's have a bit more detailed view into the same topic. I'm not using a lot of time to this because it gets very detailed. But if we take the current risk assessment methods used in the clinic today, this is from Finland. We have done this for like several other regions in the world as well, and it works in a very similar way. We just have a bit of a different names for the different diseases. So here we have FinRiski for cardiovascular disease, we have FinD-risk for type 2 diabetes, and then we have a test for kidney disease, liver disease, lung diseases. Now, if you want to assess these risks in the current healthcare practice, you need to collect tons of data. I mean, the fact is that no one does this routinely in healthcare. Maybe if you go into some I don't know, executive clinic and you pay a lot of money, and maybe they run this, maybe they run something even more detailed than this. But what I'm talking about here, I'm not talking about the richest 1% in the world, because that doesn't solve the healthcare crisis. I'm talking about what can we do in national scale? What can we do in large scale? And the capability to assess these risks for all of these diseases efficiently in a scalable manner with a low price point, it's a transformative capability to build the primary care system differently, to create a preventative primary healthcare system. With Nightingale, to assess the risks for all of these diseases, one blood sample, age and sex, and you get it all with equal or better performance. It's a transformative ability to change how we do healthcare, primary healthcare in the future. And now many times with these technologies, they may work in a lab or they may work in a limited R&D environment. This is different. This is available today for healthcare use. This is already being used nationwide here in Finland. This is already being implemented across the globe. So I truly believe that the time for preventative healthcare has come, and Nightingale's technology play a significant role in enabling that opportunity. How is it implemented at the moment? Well, how does it look? Of course, in our webpage we have more details about this. You can have a look, but basically, what happens? The patient or the customer gives a blood sample either in a lab or self-collected from a finger prick. I think both ways of collecting the blood are very important when we move towards future, when we build the healthcare systems in a different way. The self-collected sample actually enables completely new kind of value chains in healthcare, because you are not anymore bound to the physical location. You can get the risk assessment anywhere, and I'm confident when we look over the next 5 years or so, healthcare, primary healthcare will become more and more distributed. And I think that's also something that helps to build a smarter system to take care of everyone's health. So you get the blood sample, and then then you get from that with Nightingale's technology the risk for most common chronic diseases. You have the cardiovascular diseases, type 2 diabetes, kidney disease, liver diseases, and lung diseases. And then, in addition to the risk evaluation, we also provide several clinical grade blood values. So the very well known blood values such as cholesterol values are provided with the same test and calibrated against the gold standard. So the clinicians can use these as diagnostic blood values for treating the patients. So it has the kind of the new world of the risks, kind of a new way of assessing the risk, more efficient way, better way to assessing the healthcare, the disease risks. But it has also it also provides the same tool as the current healthcare system is providing, so the blood values. So it has the both worlds in the same package. So I believe that the time has come to replace the current way of doing the risk assessments. This is just better. All right, that's it for the value proposal of Nightingale's technology. we are of course very excited to provide this technology around the world. Let's have a look at the business targets and talk a bit about the achievements that we have managed to reach in the past fiscal year. So we provided the targets we provided for the last fiscal year. We had 3 targets, and maybe I talk more about like the significance of these targets. So the target number 1. So what do we want to do? What is the stage of this company? We want to win new deals with healthcare industry partners, because healthcare is largely like let's put it this way: it's not very dynamic industry, clinical healthcare, and the reason is that it takes you have to be very careful when you start to implementing and applying new technologies, which is very understandable. So now with the target 1, our aim was to win the next industry partnership where we can demonstrate, on the other hand, the reference value, but then also the contract value. Then number 2, target number 2 was a target connected to our like self-collected samples. As I said earlier, I believe that the healthcare is moving towards a direction where you have a more distributed system. We have technologies like telehealth, but telehealth alone, I mean, it's very hard to assess disease risks if you only have microphone and camera. So you need blood, basically. So that's why we have the target number 2, to win cases where we bring our self-collection technology to our customers and demonstrate the reference and contract value. And then target number 3, it's important to remember that Nightingale is coming from hardcore medical science. We've been building the company for 10 years. By far the largest part of that has been to build the scientific background for the technology. Because of that, we have also strong business with medical research institutions, and then target number 3 was connected to that to achieve growth in medical research business. Then we also had a note about the FDA approval in the United States. Now there is a new FDA ruling in here that took place over our past fiscal year. So we will be providing an update regarding the regulatory situation in the United States. But what we are seeing now is that the regulation in the US is going to a direction that the rule book, in a sense, is getting more clarity, and with that, we believe that we can apply many of the international standards that we have successfully applied elsewhere in the world. But this is something we will provide an update later. Okay, so let's look at the key achievements. So regarding the targets in the past fiscal year, we reached the targets successfully. But if we look behind these kind of the high-level targets, so we have here put the different achievements to the world map. We are operating in 5 different geographical regions. You can see from these regions that we are basically, I would say that we are in the global hotspots of the healthcare in many ways. And these like tier 1 countries it's been very intentional process how we have chosen these market areas. In Finland, we have the most advanced progress of utilizing this technology. So here, Nightingale's technology is in nationwide use in occupational healthcare together with our partner Terveystalo. In the UK, we have a very strong position. We have a new laboratory in there. We have run the world's largest health data repository, the UK Biobank, which kind of helps, has had a significant contribution when building the scientific background of this technology. In Japan, we have also lab running in there. We acquired Veltus Inc. over in the past fiscal year to accelerate or improve our commercial position in the country. In Singapore, we have a partnership with the largest diagnostic service provider, Pathology Asia, in the region. It's very interesting market. The population, when leaving out leaving out China and India, the population in Southeast Asia around 500 million. So basically size of Europe. And then in the United States, significant advancements with several major healthcare organizations. A couple of words about all of these different initiatives. Maybe you can see in top part of the slide, we have the kind of the progress bar. The target with all of our initiatives is to reach this large-scale healthcare use. As I was telling in the beginning of the presentation, in Finland, we are pretty much there. There are some things we can still do in this country to expand the use of the technology, but I think we are very advanced. The partnership with Terveystalo has been very successful, and it's very exciting to really have the technology in clinical use nationwide. Maybe also good to say that in Finland, occupational healthcare is part of the primary healthcare system. So it's basically addressing the entire country. Then in Japan, we acquired Veltus Inc. and this is basically, we've been working in Japan for several years, but the intention and the purpose of the acquisition was to expand our commercial possibilities in Japan. So now Nightingale is basically controlling the whole value chain from the laboratory to selling the service. And because we already have 200 hospital network in Japan, that gives a very good position commercially. In Singapore, I think the key thing we are building in Singapore is we are setting up our laboratory. It will be a lab-in-lab setup together with InnoQuest, which is a subsidiary of Pathology Asia. The commercial launch is estimated before the end of this calendar year. So we are making strong progress in Singapore. In the UK, we started a new laboratory. Why UK? Well, UK is, maybe if looking at the medical science, it's I think in the population medicine, I think it's the #1 place in the world, and because we have also run the UK Biobank samples, that puts Nightingale in an excellent position in the UK market to seek growth also in there. Then in the United States, this is I think the strongest growth and the strongest kind of progress has been, I think, of course, in Finland, together with Terveystalo, Singapore, also very strong progress. But I think in the United States, we are working with some of the major healthcare organizations. And many of these organizations, they are not only major organizations in the United States, but they are some of the leading healthcare organizations in the world. And the fact that Nightingale's technology is being adopted by these customers, I think it tells the story. To get to work with this level of customers, it takes a lot of you need to have a technology that you can really create value. Then we have also announced that we will be building an independent Nightingale laboratory in the United States. So a lot of things happening in the US. And then finally, I have mentioned a couple of times the technology regarding the self-collected samples. So over the past fiscal year, we acquired all intellectual property assets of the Velvet technology, which is it's basically like a blood collection and transportation device. And we are the only provider in the market who provides the collection part and the analysis part. Usually, companies in this industry, they either provide the collection part or the analysis part. We offer both, and this integration brings significant benefits. This is, by the way, also only technology in the market that allows a sample stability time up to 3 weeks. So if you think about how to build like distributed primary healthcare systems, you need to have a long sample stability time so that you can transport the sample in a post, basically. Up to 3 weeks. That's good enough. All right, that's it. The past fiscal year, then business targets for the current financial year. We have a same model, 3 targets. The reasoning behind these targets is that we are still, as a company, we are still in a stage where all the focus is in winning new large international deals. So that story continues, and I think for a shareholder, I think the key thing to follow is the wins that we can achieve with our partners and customers. Target number 2. Now, when we are getting more and more deals and the international operations are ramping up, we of course have also focus in revenue, and the aim is to increase the revenue compared to previous fiscal year. And then when the revenue is increasing, we are of course also following the efficiency. I think we have very strong track record in how we have managed the cash position we have, and it's been like it's a very long-term process that we have started already after getting public, and this very systematic process is still something we will continue in the future, and there will be more and more emphasis also to improve the EBITDA levels. The midterm and long-term business targets, no changes in here. We believe, I think the main thing to say here is that we believe that we are on a good track to achieve the positive EBITDA midterm. about the remuneration report. No major deviations here from the past financial year. I think the key target here is to supporting to that we achieve the strategic targets, profitability, and increasing shareholders' value. So that's it. Thank you.